Good afternoon and welcome to my intervention presentation and capstone video reflection. In the healthcare sector, several problems and disparities exist that require formulating and implementing effective interventions. This is because the interventions will help improve the quality of care and health outcomes of the patients, thus making them satisfied with their care. When patients are satisfied and their medical needs addressed, they can easily recommend others to the facility. In this case, developing a promising intervention for diabetes patients not only improves their health outcomes, but also leads to a better quality of life as they have adequate self-management information. The majority of those affected are African Americans, and this intervention will increase their access to care and contain their condition. According to El Grante et al., 2019, patient education is vital in managing chronic diseases such as diabetes as it enhances behavior change and self-management. This presentation is meant to assess how the intervention of patient education improves self-management and improved outcomes. Diabetes self-management is vital in healthcare provision because it helps patients stay healthy while adhering to the guidelines provided by the caregiver. Thereby, it needs caregivers to communicate and provide patient education about enhancing their self-management efforts for better outcomes. The intervention I provided, an educational brochure on diabetes self-management, had a significant impact as the majority of the patients reported that the document contained valuable information that could be used to enhance self-management. 3 of the patients who have weekly appointments said they had not been informed of the importance of physical exercise and enrolled in walking groups. The patients also reported that the brochure was a valuable item as they used it as reference to adjust their eating and physical activities. 10 patients could not navigate using smart devices to monitor blood pressure, log meals, or monitor physical activity levels. These patients were provided with the necessary technical support and their devices linked with the phones for easier monitoring and feedback. In general, the patients provided positive feedback as they had reference material that they could use to do diabetes self-management. This is because they expressed that they were comfortable doing several self-care activities and can stabilize their A1C levels, except for those who required high home care services to stay healthy. The patients had improved knowledge about doing self-management, and they were willing to help others stay healthy. According to Duarte Garde et al., 2018, diabetes management intervention should be informed by the available evidence that supports their efficacy. This is because when enough evidence supports an intervention, it gives the caregiver the confidence to use it to provide better outcomes. In developing the Capstone Project's intervention, there was an in-depth analysis of peer-reviewed articles and books covering diabetes self-management. The articles covered ethical issues in diabetes management, technology use, dietary modification, physical exercise, and glucose monitoring. These materials provided relevant and recent information that can match with the prevailing conditions in facilities and practices. The materials helped educate the patients about the benefits of self-management after discharge. These enabled patients to understand the importance of monitoring their dietary intake, exercises, glucose levels, and technology to boost diabetes management. All the resources were critically appraised to ascertain their relevance, applicability of findings, and suitability to enhance self-management. This enabled me to develop an intervention that caters to the needs of the patients and improves health outcomes. Technology use has been on the rise in care provision as it allows facilities and patients to save on time, improve diagnosis, monitoring, and access to care. According to Greenwood et al., 2017, technology use in managing and treating diabetes has been essential. It promotes increased communication, monitoring, and generation of data, patient education, and provision of feedback. In diabetes management, all the 4 elements mentioned above are essential as they help in regulating A1C levels and preventing the occurrence of hyperglycemia. Hence, The first recommendation that the project made was the use of portable glucose monitoring devices. These devices are vital as they help patients take appropriate action if their sugars are above the recommended levels. Another technology that the patients were educated about is the use of smart devices which monitor physical activities, dietary monitoring, and blood pressure measuring. The good thing with most of the smart devices that some patients tested is that they could be linked to their phones and electronic health records. This allowed the facility to provide recommendations through virtual visits about the next course of action. Some of the patients who had physical activity and dietary monitoring reported improved A1C levels as the apps linked to the smart health watches provided instant feedback about daily targets. Those patients who lived far from the facility could receive care and provide feedback through the telehealth sessions. This lowered the amount of time spent traveling and the related costs while improving their adherence to self-management activities. Healthcare policies in the healthcare environment are essential as they help caregivers provide the highest standards of care while protecting the interests of the patients. This is noted by Kuna et al. 2020, where it is stated that healthcare policies should be considered in every intervention that nurses develop to ensure that they are within the law. This is because any violation of practice regulations or healthcare policies results in serious ramifications. One of the vital regulations is the New York Nursing Board Practice Regulations contained in the Education Article 139. This helped formulate my intervention to educate them about diabetes self-management. Other important policies include the Patient Safety and Quality Improvement Act of 2005, HIPAA, and the ACA. All these laws and regulations are geared towards protecting the interests of the patients in developing interventions, patient safety, and technology used in the provision of care. HIPAA enables nurses to know what to follow or do if they use technologies to provide care and protect patient information and confidentiality. The ACA, on the other, promoted provision of affordable and quality care. Thereby, any intervention developed like patient education has to provide relevant information with heavy expenses. Lastly, in implementing the project, all patients were notified of their rights and privileges regarding care provision, and they gave consent. Implementation of projects needs to be evaluated to ensure if it has been a success or some adjustments need to be made. In my case, the initial prediction was exceeded due to the feedback received from the diabetes patients. One of the objectives was to improve the patient's knowledge about self-management. The majority reported that they were gaining independence as they had the necessary information to implement self-care activities. The number of patients who used to attend in-person visits reduced as they had kept their A1C levels normal and only needed virtual visits to monitor their progress, gather feedback, and receive further instructions. Even those who continued attending regular visits reported improved blood sugar levels than before. This clearly showed that the educational brochure provided helped them to adhere to the self-management activities. Also, the project was cost-effective, as it did not cost much to provide the brochures and link the patients to local resources that could help them manage their condition. The self-care activities recommended in the brochure were those the patients could afford to engage in and access fresh and nutritious meals that help them stay healthy. During the Capstone project development and implementation, I gained a lot of insight and experience both personally and professionally. It has enhanced my knowledge about the importance of research in implementing change in a facility and improving patient outcomes. The project also has provided room for understanding the need to observe the ethical standards and regulations while providing care. This is because through following the ethical principles, caregivers can provide high quality care that also protects the safety of the patients. The interaction that I had with the patients has proved vital as it improved my knowledge of handling patients and how to meet their needs while upholding professionalism. The Capstone project impacted the patients significantly and improved their adherence to self-management activities while being satisfied with their care. Due to the cost effectiveness of the intervention, the patients reported improved knowledge as they used the brochure as reference material. The intervention used various technologies, health policies, and EBPs to improve patient outcomes and meet the project prediction and develop my knowledge skills.